Uniters, so glad you're here. Got our new special, Pandemic, United We Stand. Got some great guests for you. We're going to talk to a nurse who has survived COVID-19. We're going to talk to a local business owner who has donated a bunch of masks and ventilators, which is an amazing story. We'll get to that. And we're going to talk about homeschooling because you're now a homeschool teacher. Congratulations. That was thrust upon you and will be the case for a long time now. So what do we do? How do we do that? Tons of great free resources out there to help your sanity and your kids as well. So we'll talk about all that coming up. Excited for that. I do want to start off, though, maybe a different place. A bit of concern I have. A worker in Modesto, California, at a Frito-Lay's factory got COVID. They shut down the factory. 2 Trader Joe's grocery stores in New York City had employees sick. They shut down the grocery stores. 6 Amazon warehouses have people sick. They either shut down for a while to clean them or they kept them going but told people around them to go home and not work anymore and go quarantine for 14 days. And we have no idea how long this is going to last still. Those stories in particular, we're going to hear more of them every day, are concerning to me because those are related to supply chain. My local grocery store, it's got a ton of food. It's amazing. I go like once a week, right? We're trying to limit everything, right? We've gone about once a week. So I went maybe a week and a half ago or 2 weeks ago and nearly empty, right? Because it's part of the big rush. And I look around like, this place is never going to get food again, right? There's never going to be food here ever. And I went the other day and it was almost stocked completely full. Like that's an unbelievable testament to America and to the free market and to farmers and distributors and truck drivers and grocery store workers. Like, amazing. Actually, I go on these kicks about grocery stores all the time in times of peace and prosperity. I love going to the grocery store. I walk into the grocery store and it's like, where's all this food come from? This is unbelievable. Especially now, I'm like that. And that's fantastic. But what happens, and I genuinely don't know, I'm curious here. What happens when at your local grocery store, 5 employees get sick? What does the local Kroger or whatever, wherever you are, what does that local grocery store do? Do they shut down? What do you do when grocery stores shut down? What happens when distribution centers get enough people either sick or quarantined or decide not to show up that they can't function properly, like it can't distribute things? Well, I'm not here yet, but I just want to think about this. About 3 weeks ago, I suggested that you calmly and patiently go to the grocery store and get 2 weeks worth of food. Now, the point of that was to avoid people. I don't want you to be anywhere near a bunch of panicked people. It's a very dangerous place to be and just not a fun place. I don't want you to be outside for 3 hours in line at Costco, right? So that was to avoid people. But there might be a time soon, and this depends where you are too. I'm in San Diego, so California is not as bad as New York City right now, but worse than most places, so it depends where you are too. But there might be a time soon when you need to go to the store, not so much to avoid people, but because there might not be as much food to choose from. Tons of variables still to happen here. Tons of variables. We're not there yet. Depends on how things last, how long they last, how many people end up getting sick, how many places have to close down because too many employees are sick. It's amazing our supply chain's lasted as long as it has. It's the supply chain that I'm starting to think a little bit more about, and it's our people on the front lines. Mount Sinai Hospital in New York, they put out a statement about one of their nurses dying from COVID. We have a picture of him right here. He doesn't look like an 80-year-old guy with emphysema. And he's not going to be the last nurse or doctor to die from this, or certainly not to get sick and knocked out or not to show up to work because they don't have the proper equipment. Have you seen this? These are some nurses at that same hospital. That's their protective equipment. That's all they got, garbage bags to protect themselves. So how long until, it doesn't take a lot, 20% of nurses, I guess that's maybe a lot, 20% of nurses say, no way, I'm not walking into that. And I don't even mean like in a rude way, I have like lung issues, respiratory issues, and I can't go in. It's super dangerous because then I'm just going to get sick and need a ventilator. So what do you do then? And we can go even further. Erin Burnett on CNN, she said that the mayor of New Orleans told her that over half of EMS personnel in the city are under quarantine. And in New York City, sick call-outs of the New York Police Department are 2,800. So that's getting close to 10% of the force, right? What do you do when that's the case? Now, real quick on your safety, police officers getting sick or police officers under quarantine, Rikers prison, they just let 300 prisoners out. 2 days ago, the LA County Sheriff said that they're going one by one to close every gun store in LA County. Now, the next day, he came out and said they're not going to do that yet. He's got to seek further guidance from the governor, which doesn't inspire much confidence. Newsom's not exactly, he's done a great job so far, but he's not a big gun guy. And all he's got to do is flip a switch and shut down the entire background check website, and all the gun stores in California are closed. You want to cause panic? You close the gun stores and let prisoners out. Not a super smart move. And you have a lot of sick and quarantined police officers. That's a really interesting recipe that we've never experienced before in America. I truly have no idea what's next. This thing could spiral out of control completely tomorrow and just have mass pandemonium. Or it could kind of stay at this level where we're at now, where still a lot of people are like, I don't really get what the big deal is. Like, what's happening? Or it could kind of get a little bit worse and stay there for a year. Like, I had no idea. No one has any idea. But here's my point of all this. I want to encourage you to not rely on any government to save you or protect you or provide for you. Because they can't and they won't, even with the best of intentions. Depending on how things go, they just may not be able to. So what does that mean? Looking out for yourself, whether it's getting enough food for your family or loved ones or neighbors, or protecting your family, it's on you. It's entirely on you. Read an interesting fact the other day. So you know the British expression, keep calm and carry on? One of my neighbors are British, and we were talking about the British response to this. And he said, yeah, you know, he did his, I have a terrible British accent, I'm not even gonna do it for you. He said, yeah, but it's very British, the approach. Like the initial herd immunity approach, like everyone just kind of keep doing what you're doing. He said it's very British, it's very keep calm, carry on. I was like, oh yeah, that is probably right. Like that's kind of a cultural thing. So that, keep calm and carry on, you've seen that line before. That was a government mantra. I don't know, propaganda is a strong word, but a government mantra used during World War II. And help improve morale, right? And it's very like British, stiff upper lip, and keep calm in the face of adversity. It's all that, right? And that was the corona response, right? No worries, keep doing what you're doing, it's fine. A lot of people get sick, we'll get herd immunity, keep calm, carry on. There's a problem with that. It's a myth that never happened. That expression, keep calm, carry on, that was never used during the war. It was designed to be used before the war, when there were threats of air raids on the city, right? So it's encouraged people like, keep going on with your life, right? Keep calm, carry on. Oh, but there's air raids gonna come any minute now. No, keep calm, carry on. That was the intent. There was 2.5 million posters were printed, but they were never posted. They were never posted anywhere in the city during the war. And everyone forgot about them until a copy of one was found at a tiny book. This is a true story. A copy of one poster, or a poster, was found in a book at his little bookstore in a super small village in northern England in the year 2000. And the shopkeeper guy, the bookstore, he found it, he thought it was pretty neat, he posted it in his store, it got more attention, they started printing them themselves, and then it became like this whole big thing, keep calm, carry on. But it was never real, and it was never published, it was never posted anywhere during the war. But there were two mantras that were published during the war, and that were posted and painted everywhere, these big, huge murals and posters out on every building. There were two. One said, your courage, your cheerfulness, your resolution will bring us victory. Notice the word that were underlined there. The other one says, freedom is in peril Defend it with all your might. Those are much different messages than keep calm, nothing to see here, as you were. And I bring it up because it was personal, right? This was a personal plea. Your courage, your resolution. Defend it with all your might. Not stay calm, let us handle it, let us protect you, let us provide for your family. No, it wasn't that. It was you. You prepare. You provide. You protect. This is a time I've never who can stand like I've been here before. Like this is the ultimate test for our generation of patience, which I'm not doing great at, of loving your neighbor, and of personal responsibility that I've ever lived through. And we will see how we rise to the occasion. I know how you'll rise to the occasion. Now, part of personal responsibility is financial responsibility, and it can be real hard when things are all over the place, right? Like, how can you be financially responsible now when the stock market's like what are we? There's nothing more secure than gold. It's been around forever. It's going to be around forever. The Fed can't print more of it. Financial Times wrote an article the other day that Goldman Sachs tells clients it's time to buy gold. They called it the currency of last resort. Barron's wrote an article just yesterday. Gold is gearing up for a sustained rally. Call American Hartford Gold Group with any questions you have about gold whatsoever. Get some gold in your hands. Real gold in your hands, not paper gold, right? You don't get a piece of paper that says your gold is somewhere else locked away. No. In your hands. And it's yours forever. Gold is a safe haven for your retirement, but also for the moment, because security's got to be the highest priority right now, right? And American Hartford Gold, they are the trusted leader in gold and silver. Makes it super easy to get started. I remember when I called them up for the first time, couldn't have been nicer, couldn't have been more wonderful. Blake was the guy I talked to. He's wonderful. You should call him, ask for him if you'd like. They're first class, family owned, A+ rating from the Better Business Bureau. Look at their Trustpilot reviews, right? Those are people who do business with them, right? So you can trust all those reviews, Trustpilot. And give them a call. Tell them you heard about them on the first. Tell them you heard about them on our special here, Pandemic United We Stand, and they'll start you off with a free silver coin. You thought your retirement, you thought your future, your financial future was secure in the stock market until last week, right? And we have no idea what's coming next. Get some gold in your hands ASAP. American Hartford Gold Group, numbers at the bottom of the screen, 866-511-2758, or you can visit them at AmericanHartfordGold.com/free coin. Coming up, a man who donated a bunch of these ventilator masks. We're going to talk about homeschooling because you're now a homeschool teacher. Congratulations. And we're going to talk with a nurse who has survived COVID. We'll get her experience. It's all coming up on our special here, right here on the First. America United We Stand. Spread the word. Hey, Slater Crusaders, we're hearing more and more stories of people who have had COVID and fortunately recovered. I think it's important that we share every story that we can. In particular, our nurses who are on the front lines of this and at a much greater chance of getting it. Lisa Merck is one of those nurses. She's an advanced practice nurse in Colorado. Lisa, how are you?
I'm doing really well today. Thank you.
Good. I'm glad. Let's start before this even. What's an advanced practice nurse? What's your normal day-to-day at the hospital?
So right now I'm not working in the hospital. I have my own, my husband and I have our own clinic in Crested Butte, Colorado, where we see patients. I see patients. He does practice management and all the billing. So we live in a really small community. So we see patients from our community. I do OBGYN and primary care. So I'm not delivering babies anymore, but I'm doing primary care and gynecology.
How do you think you contracted COVID?
That is a really good question. That's the magic question right now. And I have no idea where or how I contracted COVID-19.
I wish you did for your sake, but also so we'd be like, oh, avoid, that type of thing or whatever. But so nothing comes to mind of like, oh, like someone sneezed in my face or like I touched this thing and touched my eye, like none of that.
No, nothing like that. My husband and I traveled for 3 weeks. I went to a medical conference. I came home and I started feeling ill. So they think, after I talked to the state epidemiologist, they think that I contracted it in Colorado from my signs and symptoms that I had. So I have no idea where I got it. I'm really diligent about washing my hands, cleaning the surfaces in my office, coming home, cleaning. If I go to the bathroom, I wash my hands, I take a paper towel, I open the door. So I don't know where I got it. I don't.
Yeah. Walk us through your symptoms and your whole trajectory, because again, everyone's very different. That's maybe one of the things that's kind of frustrating about this is it's all so different. But what was your experience?
So my experience, it started out around February 18th. I'm on week 5 of my illness. The World Health Organization is stating right now that the illness is lasting anywhere from 3 to 6 weeks.
Wow.
Today, I'm actually going down to get another repeat COVID-19 test, just because I'm a healthcare worker, so I need to have 2 negative tests in a row before I can go back out and start practicing and seeing patients again. But my symptoms started out on February 18th. I started just having a little runny nose, and then I started having a few sniffles, and that was it. The next day, I started having pain in my left shoulder area, and then it started running across to my back, where my shoulders were. And I thought maybe it was just from traveling. We were on a train, we were on a bus, we were on multiple airplanes, we were carrying backpacks. So I thought maybe it's just muscular aches and pains. And then I felt fine after that. I went and got a massage. I felt okay. I had 4 or 5 days that I felt great. We volunteered for a race. I watched my little nephew. I hung out with my sister, my husband, my friends. We went out into the community. And then I saw patients because I didn't feel bad. And then March 1st, 2nd, and 3rd is when I started feeling feverish. I got a fever. And then I felt fine again. My fever was probably the highest my fever was 100.8. And I started having mild headaches. I had headaches for 2 days. And then I had a little eye pain when I rolled my eyes around. The next day I woke up and I had a little matter in my eyes. And then I just started feeling worse from there. I started getting very diaphoretic whenever I stood up. I started sweating. I felt like I wanted to collapse. I started having shortness of breath. Whenever I took a deep breath, I could feel hot air right here when I started having deep, like a deep breath, like if you went out into the cold and it hurt. And then I started having shortness of breath. On March 8th, I started, in between that time, I started having severe nausea. So I asked my husband to take me to the hospital because I just felt like I wanted to collapse every time I stood up. I was very dehydrated. My lower back was hurting down by my ribs. So I asked my husband to take me into the hospital. On March 2nd, I actually called the CDC and I called the local health department and I gave them all my symptoms when I had a fever and my husband and I were laying in bed, just laying low. They said I didn't meet criteria despite my fever, being a healthcare provider, and our recent travel. They said that I didn't meet criteria. So just kind of laid low. And then on March 8th is when he took me into the hospital. They did a full workup on me. They originally did influenza A and B. That was negative. They did a chest x-ray and they noted that I had bilateral lower lobe pneumonia. They did a CBC, which is a complete blood count, and then a comprehensive metabolic panel. Everything looked fine on my blood work except my white count was low. It was like 3.2 and the normal was like 5.2 or 5.4. There's a range in there. And started an IV on me, gave me Toradol, and then they finally gave me the COVID-19 test on March 8th, and I didn't get that back until March 11th. So I've been in isolation since March 8th. Now I'm going back.
Okay.
I'm going back down this morning for a repeat test. And
I have a ton of questions. So first of all, what stands out to me that first of all is how long this is lasting, but also the ups and downs of it, right? Is that fair? Like it was bad and then you got and then you were better and then it worse and then better. And like has it been that?
that's correct. One day I will feel fine, and then the next day I might have tachycardia and really bad nausea. No vomiting, but just really bad nausea and some anorexia where you don't feel like eating. And then the shortness of breath comes back. The last week, my symptoms have been severe anxiety, nausea, and shortness of breath. And then I've also had a little bit of tachycardia as well.
What is it? What's that? What's tachycardia?
Tachycardia is a high heart rate. And I don't know if it's just the anxiousness of being isolated, the fear of the unknown, all the news. I don't know where the anxiety is coming from, but a lot of my friends and people around the world have reached out to me and they're like, I'm anxious. I feel depressed. Because there is a lot that's going on right now. But also, I don't know where the high heart rate's coming in. Maybe it's my body just fighting the virus still.
Yeah. What's for you, and this is super helpful for everyone else who may be experiencing all this. What was the last straw for you? Because we're hearing like, don't go to the emergency room, don't go to the hospital unless you need to. But what does need to mean?
Need to is if you feel like you're going to die, like you feel like you're going to collapse, you can't breathe, you're very severely dehydrated, you can't keep any fluids down. I would recommend going to the hospital. If you feel like you need to call 911, call 911 or go to the nearest emergency room. That is what we're there for. However, we can't take patients that are just coming in with ear pain or, maybe a sore throat, or they're waiting because they didn't go to the doctor that day. The emergency room is there for people that are severely ill or critically ill. That's when we need you to come in.
Okay, so can't breathe is that standard most likely. Talk about nurses and you, not in a hospital still, but also people in hospital. Like, what should we be thinking about them? What do you want to say about them who don't have the proper equipment and who are working crazy hours and we think it's only going to be getting worse?
Well, it's really scary because even though I am working in the clinic, I'm going to probably go back out into our community and try to help as soon as I get cleared. We need the PPE. We need the proper protective equipment. If we don't have that to save our lives, we can't save your lives. You have to protect the healthcare workers. We're your soldiers on the front lines. I have nurses, my friends, that have told me that when they go to work, they're told, here's some masks, and here's a gown. You need to put this in your locker and make it work for the rest of the week. I have nurses that are scared to go back to work because they don't know what they're going to be provided with. And some of them are like, if I'm not provided with this type of equipment to protect myself and my family, it's vital for my life, I'm not going to work there. Nurses are wanting to quit. Doctors are wanting to quit right now because they're exposed. They're the most exposed right now. And they're just deathly afraid of getting exposed themselves, but also bringing it home to their family and their loved ones. Yeah.
That's such a problem. So Lisa, there's no wrong answer here, right? And I was just having this conversation yesterday with a friend whose wife works at a hospital. She's not a nurse, but she works at the hospital. And the question is, they had a family conversation, like a really serious family conversation of when you don't go to work anymore. So you personally, what's your line or what's your standard for when it's appropriate for me to go and when, for the sake of my family, I don't go anymore? How do you think through that?
So I'm going to be a little different, because I do have the coronavirus now. My body is building antibodies. I don't know when I will be fully protected. I'm very, very worried about getting reinfected because there's so many unknowns of the virus right now. I am going to demand that I have 2 negative coronavirus tests 24 hours apart before I go back to work, see patients, or expose anybody else in my community. Originally they said I could go back to work and not have the COVID test, but I don't think that's fair. The CDC is saying that I need to take 2 negative tests in a row, and our local state is saying that I don't. So I called and emailed and I said, I want to be tested before I go back in the community and expose any of my patients, because I could be a carrier and I could be shedding the virus and spreading it to patients. We also have a little pediatric clinic in there too. So it's a women and children's clinic. So we don't want to expose anybody, or especially our vulnerable population out in the community. So before I go back to work, that's going to be my standard. So I could be in isolation for another 1 to 2 weeks, because testing right now is taking anywhere from 5 to 7 days to come back in our community. But I think all over the states right now, it's taking that long because they're doing them in batches.
Okay, Lisa, we got to run. We got 30 seconds. What's just your final message? What do you want to get out there to everyone watching now?
Heed the warnings of our leaders. Stay at home. Stay isolated. If you feel bad, please stay home. Don't expose anybody else. Don't shed and spread the virus. Protect your family, your friends, your community, and most of all, like your healthcare workers right now.
Lisa Merck, so glad you're feeling better, and I hope you get better 100%. I hope you get that second test back quick and you can get back out there and help more people.
Thank you. I will keep you posted, and thank you so much for having me and spreading the word.
You are very welcome. Thank you, Lisa. More coming up. True story. Mike Slater, spread the word. Hey, Slater Crusaders. So with schools being closed across the country, like indefinitely, a lot of parents have been faced with becoming a homeschool parent all of a sudden. And again, potentially for a very long time. And maybe you really, really did not want to ever be a homeschool parent, or at least you didn't anticipate yourself being a homeschool parent. But alas, here we are. And I feel like we shouldn't waste this time that we have in front of us now. So how do we make the best of it? Lindsay Burke is here. She's the director of the Center for Education Policy at the Heritage Foundation. Ms. Burke, how are you?
I'm great. Thanks for having me.
Good to talk to you. So where are we right now? Just in light of everything, like, what are you hearing about what's coming in terms of schools, and what are we faced with in this regard?
Look, I think you're absolutely right. Everybody woke up and were faced with the reality that all of a sudden they're homeschooling. We had an article out last week that said we're all homeschoolers now. And I think that's exactly it. Parents are waking up to this new reality. Look, this week, as of Monday, we had 46 states that had closed schools entirely. And that, in some instances, included both public and private schools as well. It's 123,000 schools across the country. And that has affected more than 50 million children. So yes, when we say we're all homeschoolers now, we are practically all homeschoolers now. And that has been a real shift for most families across the country.
Okay, so before we talk about what to do or suggestions on how to do it, what mindset should a parent now have? Because parents are potentially juggling a lot, right? So some parents still working from home and homeschool. So how should we think about this?
So I think that's a really important question. We know that there are some school districts in some states across the country that are still sending pretty significant amounts of homework home and requiring parents to really engage in some cases hours of homework. I think the mindset, though, that we should have at the moment is that let's try not to necessarily replicate what your child's prior school was doing, either public or private, but take this opportunity, as odd as it is and as strange as this new normal is for us, to take the opportunity to be at home with your children, have it as sort of a lesson for them, this event that we're all experiencing together, and then leverage some of the great resources that have really just abounded over the past couple of weeks as a result of a robust free market of content. And I think that's one of the most exciting and sort of inspirational aspects of this, is that there are so many resources out there and so many free resources that are out there as well.
Yeah, I don't know what homeschooling looked like 20 years ago, but today it's wildly different. And like, even for adults, like Like my entire university experience, which we paid $200,000 for, is available for free online right now. So that's something. But what do we got? Run us through some of the options that you put on your website, dailysignal.com, on the Heritage website. What are some free resources that are out there?
Yeah, and I'll say, just to your point that you made a second ago, you're absolutely right. 2 decades ago, homeschooling was sort of this fringe thing that not many folks did. And now we have seen pre-pandemic a huge increase in the numbers of families homeschooling. We're up to about 1.6 million kids across the country, or about 3% of the school-age population that's currently homeschooling. So we had already seen a pretty sizable increase over the past 2 decades, but of course now we're all having to do it. I think part of that is because parents do feel a little more confident, because there are so many great resources out there. So you're not just doing it alone all of a sudden. I'll give you a few examples. One that I found that I think is really neat is Project Gutenberg, which is an online library of 60,000 free books. So they're all ebooks, but it's the world's greatest literature that's out there. It's been made available online in full for free because their copyrights have expired. And I would also point to this really fantastic resource that the Ashbrook Center has put out called Teaching American History Project. And this is just a treasure trove of solid history resources, and they explore themes in American history and self-government. So that's a really fantastic resource. I would check out the Core Knowledge Foundation as well. Their entire curriculum is now online for free. And then there's some more just sort of fun things that families can do together. The Space Foundation has partnered with Peanuts, the comic, and they've created free lesson plans that help catalyze the next generation of space explorers and innovators. There are also things like Code Break that help students who want to engage in computer science. So there are all types of really interesting resources that are out there now that parents can leverage.
How can all this be free? Like I'm looking at the Core Knowledge Foundation curriculum, and even that Code Break are live weekly webcasts, right? Like, wow, how is this stuff free?
Yeah, so a lot of these companies, private industry, nonprofits have stepped up during this pandemic to put their resources online for free. Some of these are going to be online temporarily for free over the course of this emergency that we all find ourselves in. So they might not be free in perpetuity, but for the moment, they're there, and parents should definitely take a look.
This is neat. The Cincinnati Zoo has a Facebook Live safari every day at 3 Eastern as well, which is pretty cool.
Amazing.
Tell us about first of all, I'm super grateful for you putting this list together. And again, it's on the dailysignal.com website, Heritage Foundation website. Just Google Lindsay Burke and you can find it here. So I'm grateful for you compiling this because who do you trust, right? Because if you're looking to help your kids with American history stuff, like you may end up on the New York Times 1619 Project website before you end up at the Teaching American History Project website. So I'm grateful that you found the good stuff.
Thank you. Well, and sorry to interrupt, I would just say, compiled it to answer your question. We have something at Heritage now called the Curriculum Resource Initiative, and all of these resources and many, many more resources are included in this Curriculum Resource Initiative. So if you Google it, you'll see it immediately, Heritage Curriculum Resource Initiative, and it's trusted resources. So it does link to things like Teaching American History and not things like the 1619 Project. So they are trusted resources, and it's really an in-depth resource for families.
Talk to us about age expectations. Obviously, there's a huge range here, right? So, but like, what would your expectations be for a 5-year-old versus a high schooler, generally speaking?
Yeah. Well, I think for the most part, high schoolers, they are, for the most part, pretty self-directed, and I think can really take this opportunity to explore some of the areas that they might be interested in that they might not have the opportunity to explore during a more structured school day. So I think giving them that freedom and flexibility really to direct their own education during this time is important. I don't have young children myself, so I know that's a huge struggle. I know that you have several young children, and having a few kids under the age of 5 is certainly all about time management during this pandemic. So I think that's important. Allow your older children just to explore and really develop their own educational interests at this point.
We have no idea what's to come for any of this. I'm hoping some good structural, cultural things change moving forward. And one of them I hope is a lot of parents can see, oh, I can do this. I can do this. This can be done. Where before it seemed like just an impossibility. Maybe now at the end of this, there's a light that people can see. What do you think of that?
Yeah, so I think it's going to break one of two ways. I think you're right. Your instincts are right that probably, for the most part, parents are going to see, you know what, I can do this. I can homeschool if I need to. There are resources out there that are available to help me do that. Now, homeschooling is not going to be the right fit for every child, for every family's work arrangements once they return to this sort of normal pre-pandemic world. But I do think for a lot of families, it will give them that confidence boost. Now, it could be the case that it breaks the other way, that we have families who say, oh, wow, this homeschooling stuff, I tried it. It was not the right fit for us. We're going to return to our prior school arrangement. So I don't think we're going to see a massive disruption of K-12 delivery as it's currently structured, but I do think we'll see an uptick in homeschooling. And so I think it's important to know that figure that I mentioned earlier, just to set a baseline, that we have about 1.6 million kids now who are homeschooled. That's about 3% of the US K-12 population. So we'll be able to see moving forward after a year, does it increase?
Yeah, I think doubling would be awesome. That'd be a great goal. What should people Google again, Lindsay, to find all the resources that you put up?
So the Heritage Foundation has a coronavirus webpage that you can Google and pull up. But I would also recommend our Curriculum Resource Initiative, which just has tons and tons of information for families, free options that are out there, lots of curricular resources.
Curriculum Resource Initiative. Awesome, wonderful. Lindsay Burke, thank you so much. Appreciate you.
Great, thanks for having me.
Good stuff. Mike Slater, more coming up. Spread the word. Hey, Slater Crusaders, I want to go to Trevor Theriault. He's the CEO of ManaMed, because one of the big stories these last few weeks has been lack of masks, particularly the N95 mask. And Trevor's done his part to make that problem a little less of a problem. Trevor, how are you, sir?
Doing great. How you doing?
I'm great. I'm glad you're here. So tell us, I'll just cut to the chase here. You donated how many masks?
Yeah, so the Hoag Hospital System, I donated 5,000 masks. Hope to do a lot more. But obviously, being a small company, we're doing our best to keep up.
Yeah, so it's one thing to, like I want to donate masks, right? But I don't have masks. How do you have masks?
Yeah, so, manufacturing medical devices, being registered with the FDA, and having several market-leading products, we're able to work with our production lines and change them to do the respirators.
Wait. Okay, no, back that. So first of all, what do you guys do? What does ManaMed make normally?
Yes, we make orthopedic devices. So when you go into surgery, one of the products that we manufacture is the squeezers that wrap around your calf to prevent a blood clot. So we've been manufacturing for about 4 years in medical devices. I actually started as a sales rep and got into manufacturing. Fell on my face a couple times, but being a former athlete, I was able to get back up.
Nice. So what's the connection between that and respirators?
It's basically going down to the production line. So, after manufacturing for a long time, our plants have relationships at sister plants, and that allows us to kind of jump the line to get these respirators.
What's the biggest hurdle in that process for you?
The biggest hurdle right now is funding. The FDA, the CDC, and President Trump have done a great job with allowing international certifications and guidelines to be used in the hospital system, even to a point where the shortage is so bad, we are allowed to use industrial grade masks in the orthopedic hospitals and the hospitals for our nurses.
What's the difference there? Industrial grade versus medical grade? Are those the two standards?
Medical grade requires a 510K, which is an FDA approval, where an industrial grade requires almost the same standards, just not a final stamp off from the FDA.
Okay, so we've lowered some regulations in order to make that happen.
Correct.
I think of, we've talked before about this, like we need this wartime footing of retooling Ford and GM factories to not make cars, but to make respirators. And that sounds really romantic and wonderful, but that's got to be way more difficult than how I just said it in one sentence. So what are some of the big difficulties there?
You're exactly right. I mean, the red tape it requires to not only be a medical device certified manufacturer, but all the stuff that has to happen in the background, from a testing to sending it to a lab for 15-day delay to get your test results back. So you can't just spin these up overnight. I know everyone's trying to do as fast as they can. On my LinkedIn, I posted last night, we should have the cruise ships as makeshift hospitals to treat the coronavirus. But when it comes to the demand, you got to imagine 80 to 90% of medical supplies are made in China. I'm doing everything we can to bring it back on U.S. soil. I'm part of the problem, but I think now we're realizing that when it comes to a pandemic or a crisis, we need to get our devices back here and take care of America.
So I don't blame any manufacturer for doing business, having done business in China for all these years. It's efficient, or it made efficient sense. We want to sell it for a lower price. Like, no problem, right? But now I think, as you said, we're starting to rethink some things. So if I may, how much money did you save in the past by doing it in China? And what changes would one have to make in order to bring that back to America?
Yeah, I think when you actually look at the facts, probably 40 to 50% of our bottom line is saved by manufacturing in China. But then if we take it to a step further, I wouldn't be able to have my 25, 30 employees if I was making in the States. So my goal is whether it's through federal tax credits or doing a job fair for 100 employees, there has to be something to convince the medical device manufacturers to come back on U.S. soil. And it's gotten to a point where even the stocks of the big medical device manufacturers are moving overseas. And if we look at it from a California and Texas standpoint, we have medical device factories leaving in the droves from California to Texas.
And then if I remember, this just hit me, but I remember Obamacare even taxed medical devices even more, making it even more expensive. On top of that.
And people don't understand it's a spiral effect. I always look at it down from the patient level. As our premiums go up, what are we getting in return? Well, if the hospital is spending more money on these devices through taxes, regulations, and the cost of goods that the hospital has to buy ends up costing more, then they have to go renegotiate with the insurance for more money, which then affects us and our premiums.
But you're saying it is possible for you to bring some of this, or not even you specifically maybe, but just in general, for medical manufacturing, medical device to come back?
Yeah, I think if we do it in the right state and the right time, I think the job market for medical devices would be gigantic.
Okay, that's good to know. It's possible. See, some good things may come out of this in the end. So real quick about masks. So what's the hardest thing about making these masks? Because there's different types of masks. Surgical masks, and you mentioned all the N-whatevers.
Yeah, so I think I just read 3M has the capability of doing about 30 million masks of the respirators a month. We're going to need over 1 billion masks over this pandemic, probably within the next month. So my biggest problem is funding. It's really not so much keeping up with the demand. It's funding the factories as fast as you can for them to get you in the production line to produce the masks.
Why does China want to bring them here? Don't they have their own problems that they got to take care of?
They have their own problems, but they've held a lot of the masks within their borders during the crisis. So now the factories are able to basically get masks out of the country.
Okay. Well, good. Well, I'm glad you were able to facilitate that and make that happen. Do you have any other final thoughts for people and maybe other CEOs to make some good decisions moving forward?
Yeah, I mean, I don't know if you saw it today, but Apple, Salesforce have donated masks. I think Apple did over 1 million masks. The question is what kind of mask? I highly encourage them to step up to the respirator grade mask and not just a simple throwaway surgical mask. But I think if we all come together from the private community, we can really help out our government in a fast and timely fashion.
Beautiful. Trevor Theriault from ManaMed, the CEO. Trevor, thanks for the donation. Thanks for doing that. Appreciate you.
Thank you. Appreciate it.
Thank you, Slater Crusaders. Thanks for being on our latest coronavirus special. We've got a whole nother weekend. We'll come back, and this is far from over, and we'll be here on the 1st.